Welcome back. Users of private healthcare in South Africa are set to pay the price for the further delays in the publication of the Competition Commission's report on the health market inquiry. Its work was originally due to begin in 2015, but it's been suspended because of budget constraints. Let's get you some reaction on this with Munyana Rugege. She is Section 27's Executive Director. Munyana, very good morning to you and thank you for coming in. I said 2015, but the report, as I understand it, the work was due to begin in 2014. 196 million rand has already been spent, and now we're hearing that the budget is what's going to stand in the way of its publication. How much money is needed?
Well, we don't know how much money is needed, and we're very cognizant that the Commission has to comply with the relevant laws, including the recommendations of the Auditor General in terms of spending public money. There's a great deal of money that has been spent already, a lot of hours of work that has been done by the Commission, and we're almost there. We are disappointed in the delay. It's been 5 years since the beginning of this inquiry. We only got an interim report last year, which was a report that contained a great deal of information about the failings in the private healthcare system, about quality issues, about access and affordability of private healthcare in South Africa. And we want to get to the end of that as soon as possible because, as you know, as this inquiry has gone on, the people who are meant to be accessing those services are struggling to access services. Affordability is becoming less and less. And what we would like to see is greater attention to the inequality in the health system. And this inquiry should help us get part of the way there.
Let's speak about the delays, because I know one of the issues that came up over the years was one of the private healthcare companies, Netcare, going to court.
Yes.
What else has led to this becoming a 5-year process that has become so expensive to a point where there is no more money to spend?
Right. You know, it was always going to be a complex inquiry because it's a complex sector. And from the very beginning, we've said that there's a need to understand the complexities in this sector in order to open it up to more people, in order to see more equality in the health system in South Africa, so that we're not seeing this hugely polarized system. So what we would like to see really is for more attention to be paid to completing this process. We can't say how much it should be or how much money should be spent, but it should be a priority. We've been speaking as well about national health insurance, and of course the presidency has taken a great interest in that and is moving that process forward. And part of that discussion is what is happening in the private healthcare sector. So we need to see the end of this inquiry, final reports with final recommendations about how to increase access, because as you know, health is a human right in terms of our constitution, and all of us should be working together to ensure greater access to healthcare. And
I want to talk about the preliminary report that came out late last year. It found that healthcare in South Africa had displayed consistently rising medical scheme premiums, as well as the fact that these schemes had become difficult to understand, or had been difficult to understand. When you look at the behavior of the private healthcare companies, do you feel that they are starting to change, or are they continuing to resist a much-needed change that would benefit you and I as people who rely on them?
Look, there's some companies that have insisted on getting more and more information from the inquiry's process. And the Commission has said that part of the delays was having to respond, delays in getting information from the medical schemes and from hospitals in order to be able to analyze the data. So there has been some resistance in that regard. And one of the things that we said in our comments on the interim report was that there needed to be a stronger emphasis on the constitutional obligations, even of the private sector. So we can't assume that we can't always talk about obligations on the state and not say anything when it comes to the constitutional obligations of the private sector.
Almost out of time, but I want to come in here and ask you, because one of the things you've said in your statement is that there's a lack of political will to finalize this process. In 30 seconds, what would you like to see the government do?
We would like to see the government put in the remaining resources that are needed. There can be more transparency about what is actually required, so that the public is brought into the confidence to know what is remaining, what's still to be done, what information is still to be gleaned from this inquiry before its end, so that if the state is able to put resources into different areas, then this should be the thing just to get us over the line and start to see changes within the private health system.
Munyana Rugege from Section 27, thank you so much for your time.